Today, we're going to discuss the Medicare Advantage plans, also known as Part C. And we're going to talk, are Medicare Advantage plans as bad as people say they are? We're going to talk about some myths, some pros and some cons, and hopefully by the end of the video, you'll be able to decide if the Medicare Advantage plan is right for you. Again, my name is Cbudenz. I'm an independent health insurance broker and can shop many different options, Medicare Advantage and Medicare supplement plans, and make this process into Medicare very easy. Or if you're already on Medicare and need help reevaluating all of your options, I would be very happy to do so. But in today's video, we're going to specifically be talking about Medicare Advantage plans. And you're going to see a lot of stuff advertised on TV, on social media about Medicare Advantage plans. So what are some negative comments that you may hear about Medicare Advantage? Maybe you've experienced some of those as well. We're going to talk about what or why a lot of people have potential issues with Medicare Advantage. One of the things that's often talked about with Medicare Advantage is prior authorizations, which prior authorizations are a pretty common part of health insurance. Almost everybody who has insurance before 65 is going to have to deal with some prior authorizations. And what we mean by prior authorization is, let's give an example that I've had a client have where, the doctor wants to have an MRI done, but the insurance company is saying, well, before we do that, we want to run an X-ray, or we want to run some other tests to make sure that the MRI is, a good option. And so a lot of people don't like an insurance company saying, hey, we want to do this, but your doctor is telling you something else. So those prior authorizations will happen on Medicare Advantage. Now, it's not always a bad thing. It's not always a super long, drawn out process, but you will have them. And for some people, that might not be a huge issue for them because they're used to having prior authorization, maybe on their own individual plan or the plan that they've had through work for many, many years. So that's not a huge issue. For some people, when they're in their, getting 65 and older and they've dealt with that, they don't want to have to deal with that moving forward. And so that's a big common thing, is the prior authorizations. Another common argument or an issue that many people have with Medicare Advantage could be the network. And when we say networks, we mean the hospitals, the doctors that you can go to. Now, many years ago with the Medicare Advantage, that might be the case a lot more than it is today, where Medicare Advantage plans were just kind of coming out and they weren't as popular as the Medicare supplement plans. The networks may have been an issue. And a lot of the times now we have bigger carriers that offer nationwide PPO options, so you can travel and you can get coverage outside of your state. Nonetheless, I can understand, and everyone can understand, how once again the insurance company could be dictating where you get care, and some people do not want to have that. If they want to go, to this specific specialist or whatever it may be, they want to be able to just go there. And so sometimes on the Medicare Advantage you may have network issues, although it is a lot better than it used to be. Like I said, a lot of these carriers are nationwide, so you can go in a multitude of different states and find doctors that may take that insurance. But that's a common pushback, is the network. The other common pushback that you might hear, or problems that people may run into or talk about, is your max out of pocket. Now, your max out of pocket on Medicare Advantage can vary pretty great depending on the carrier and the state in the area that you live in. And so some states, the out-of-pocket may be a lot higher, and other states it might be a lot lower. And we're talking thousands of dollars for a max out-of-pocket. And so that can be, something where people can't justify having, a $5,000, $6,000, $7,000 out-of-pocket. Now, mind you, these plans typically are $0 a month. And so some people are okay having some out-of-pocket because they're keeping their monthly premium low, and they may not have a whole lot of health issues currently, so they can justify a lower premium with a little bit higher of an out-of-pocket. And for some people, they may have some health issues and they may not want to be out of pocket thousands of dollars. It just comes down to, that person's situation, their preference, their budget, and all of those things. So those are some common things that people really gripe about with Medicare is prior authorizations, out of pocket, and the network, where you can go for doctors, hospitals, skilled nursing facility, right? Those are some things that people are gonna say, hey, this might not be a good fit, or can we address these things? And those are some things that you're gonna hear or see online when Medicare Advantage is brought up. Now, it's important to understand what are some good sides of Medicare Advantage, because while there may be some bad or what people perceive as bad, there's definitely some good. And one of the things is the cost. In most cases, in most areas, it's a $0 premium for Medicare Advantage plan. So you're keeping your monthly costs low versus like a Medicare supplement, where in some states it can be very, very expensive, like Florida, for an example. So Medicare Advantage can save you some on the monthly premium. The other thing that a lot of people talk about with the Medicare Advantage is the extra benefits that may be included in your plan depending where you are at. And that is, dental and vision and hearing benefits included, prescription drug plan included, which is a huge thing because we understand how expensive prescription medications are. And a lot of the times, if you go with the supplement, you have to purchase a standalone prescription drug plan. And depending on the medications that you may take, that could be fairly expensive. So having all those extra benefits included for some people makes a lot of sense, especially if they need dental work done. And we know how expensive, dental services are. So that's a huge pro for a lot of people, being able to have access and not have to pay extra for those things. Excuse me. Another great thing with the Medicare Advantage, and this is an add-on. This is something that a lot of my Medicare Advantage clients will add on, and it's very important. It's really inexpensive and adds extra protection for you. And that is something like a hospital indemnity plan, which will cover your hospital stay copays. It'll cover skilled nursing facility copays. It can cover ambulance copays. It can cover all of these things for a relatively low premium, and it helps you owing X amount of copays for a hospital stay or skilled nursing. So it just plugs that gap for you so you don't have to come out of your own pocket. So having a hospital indemnity plan, having a cancer, heart attack, stroke plan, those are all great things that if you're on a Medicare Advantage plan, adding those can actually bump up your coverage, keep your costs low, and you still can get those extra dental, vision, hearing benefits that most of the Medicare Advantage plans will have. So that's definitely something to think about. I recommend it to almost all of my clients if they can be accepted onto those plans as a viable way to cover some of those out-of-pocket costs that you might have on a Medicare Advantage plan. So just to recap real quick, all the good things that we do know with Medicare Advantage is the cost, the added benefit, being able to add some additional policies that will help lower out-of-pocket costs without raising premiums significantly. And then obviously some cons we talked about. Maybe it's prior authorizations, it's networks, it's your out-of-pocket. And so hopefully this video helped you guys kind of look and say, okay, here are some pros, here's some cons with Medicare Advantage. And you may have people that never run into the cons with the Medicare Advantage, and you'll have people that won't go with the Medicare Advantage, and that's perfectly fine. It's your choice. That's the good thing about this. So you can always have a Medicare supplement if Medicare Advantage is not going to be the route you want to go. So I hope this video helps. If you guys have questions, please reach out to me. I'd like to hear in the comments your experience or what you've heard about Medicare Advantage. It's always interesting for me as a broker to understand what people are running into issues, or maybe they're great things that you're experiencing. I'd love to hear that as well. Once again, if you guys have personal questions and you want to talk with someone like myself who can walk through these options with you, please reach out. My consultation is 100% free. I don't charge you anything. And if you just have some questions and want to get those asked, please reach out. I hope you guys have a great day, and we'll see you next time.